Okay, so welcome back again. Can you hear me?
Yes, sir.
Yes, sir.
Okay. Come on. Okay. So, tapered on either side, there are two wings. Of course, you are seeing from the inferior aspect, but still then you can see the wings over here. So this centrally located bone is the,
It's a
anyone?
sphenoid bone.
Sphenoid.
Sphenoid.
This is having a body over here. This whole part is the body over which there is another bone which is articulating. This is vomer. By the side of it, by the side of it, you can see two processes like that. Okay, these processes are actually, this one. This processes, okay, you can see over here. Wait. Nice, huh? This one, this extension down. Okay, this extends the processes which are extending like this, the down. Okay, these processes are the pterygoid plates. Okay, these are the pterygoid plates. You can appreciate this pterygoid plate over here. This is the pterygoid plate on either side. Okay. Okay, this is the lateral pterygoid plate. This is the medial pterygoid plate. And in between, there is the pterygoid fossa. Okay. So these are the pterygoid processes. And this is the body of the sphenoid. So pterygoid processes, they are protruding down. On either side, these are the wings. These are the inferior aspect of the greater wing of sphenoid. Okay, inferior surface. Okay. This is again the inferior surface of the temporal bone. Okay, this is the inferior surface of the temporal bone. The whole thing. So this full area over there which you are seeing over here is the infratemporal region. Above, if you go, this is the temporal region. Down, if you go here, down, if you go, so this is the infratemporal region. What it consists of? Which bone? The inferior surface of the greater wing of the sphenoid, the inferior surface of the temporal bone. Okay, both of which are joining. So this and plus there is an arch. This is the zygomatic arch. Okay, zygomatic bone, zygomatic process of the temporal bone. So as a whole, this whole area is the infratemporal region. Is it okay?
Yes, sir.
Okay. So again, you see, this is the anterior cranial fossa, middle cranial fossa, posterior cranial fossa. So if you see, this somewhere is the greater wing of sphenoid. Okay, this is the greater wing of sphenoid. This part is the petrous part of the temporal bone. This is an extension of the squamous. So here, this area, okay, of the cranial fossa corresponds inferiorly. So over here, it corresponds down with the infratemporal fossa. This is an area which is lying just above, I mean the upper part. Okay, so you have got these different foramens. This is the foramen. Anyone? The shape is like oval shaped. So foramen
It's a foramen ovale.
ovale. Okay, this is the foramen ovale. Posterior to it, the small foramen is there. This is the foramen spinosum. So this area is corresponding to the, okay, this is just the counterpart above to the, if you see it just from below, this is the area just opposite to the, I mean above the infratemporal fossa. Again, see, this is the just, I have taken some of the, this is the sphenoid. Okay, this is the sphenoid. These are, okay, we don't, you will be more confused. Now here, again, you see, this is a sort of, we have taken it from inferolaterally. Okay, this is of the right side. So ye ho gaya zygomatic arch. Okay, this is the pterygoid plate. So pterygoid plate are two extensions on either side. Okay, two extensions on either side. So this becomes a plate which is lying laterally. So this is the lateral pterygoid plate. This is the medial pterygoid plate, and in between there is a gap which is known as the pterygoid fossa. So again, if you see this, this is the lateral pterygoid plate. Okay, this bone is the maxilla. Okay, this is the zygomatic arch. So this whole of it is the just below the temporal area. So this is the infratemporal region. Okay, or infratemporal fossa. You can see the boundary like this. Okay, like this. Okay, is it clear? This area.
Yes.
This area. Okay, now we'll just see what are okay, these are the contents. So we will just see the boundaries. Okay, anteriorly posterior surface of body of maxilla. So in this picture you can see nicely, this is the anterior wall, this is the maxilla. Okay, this is the maxilla, so this is the anterior wall. Okay, then posteriorly the styloid process. You can see over here, this not very well defined. Anyway, this is the styloid process. So this is the anterior wall, the posterior surface of body of maxilla. This is the styloid process in the posterior aspect. Okay, what else? Medially lateral pterygoid. So you can see the lateral pterygoid which is lying medially. Okay, then laterally ramus of mandible and coronate process. So it was somewhere articulating over here. This is the external acoustic meatus. Somewhere here the mandible was articulating with its ramus. So laterally the mandible with its ramus. Okay, it cannot be shown over here. Mandible has been removed. So laterally, just remember the ramus of the mandible and the coronate process. Okay, then above we have seen already. What is above? Greater inferior surface of the greater wing of sphenoid. Okay, so above this area will be inferior surface of the greater wing of sphenoid. What is there in the inferior surface of the greater wing of sphenoid? Two foramens, foramen ovale and foramen spinosum. Okay, then हो गया नीचे it is open, below there is no boundary. Okay, so it's a roof, an anterior wall, a posterior, you can't say a wall, it's a posterior limit, a medial wall, laterally the mandible, inferiorly it is open. So this area is the infratemporal fossa. Till now it is okay?
Yes, sir.
Now,
Yes, sir.
yeah, we'll see the communications. Now, let me try how far I can make you understand. So anteriorly, it is the inferior orbital fissure. So if you see the orbit, okay, if you see the orbit, wait. Okay, so this is the sphenoid bone. Okay, if you see, this is the posterior surface of the orbit. The anterior part of the anterior surface of the greater wing of sphenoid, they are actually making the posterior surface of the orbit. So this becomes the superior orbital fissure. This is the superior orbital fissure. Similarly, I don't have a picture. There is another, wait, let me find out. Okay, let me show in this over here only. So, wait. Can you see this opening? Can you see the opening below? This one. This is the inferior orbital fissure. Okay, the opening below. Can you see?
Yes, sir.
Upper mein, this you can see very nicely. It's the superior orbital fissure.
Yes, sir.
Above. Below there is a opening. That is the, so you can see the superior above. Okay, that is the superior. Below this is the inferior orbital fissure. Okay, superior and inferior. So you see the inferior orbital fissure is Wait, it's a little tricky, na? How you move your hands. So the inferior orbital fissure is communicating. So ये हो गया fossa. इसके पीछे से the inferior orbital fissure will be communicating with the infratemporal fossa. Okay. Then next is medially the pterygopalatine fossa. This is the lateral pterygoid plate. This is the maxilla. There is an opening in between them. Okay, this opening is known as the pterygomaxillary fissure. PG sa, Riturag. This is known as the pterygomaxillary fissure. And through this fissure, inside if you go, you will find an area which is guarded by the anterior surface of both the pterygoid plates. Okay, and that is known as the pterygopalatine fossa. Okay, that is known as so inferior orbital fissure. If you move like that, go inside, you'll find the inferior orbital fissure is communicating with this area. Okay, then if you go from here, you'll find this is the pterygopalatine fossa to which it is communicating. Third, the temporal fossa. It's very easy. Go from here, beneath the zygomatic arch above, this is the temporal fossa, isn't it? So this is the temporal fossa. So communicating with the temporal fossa, you go down, it's communicating like that. This part is understood?
Yes, sir.
Sir.
Then middle cranial fossa, where, how? Through these foramens, isn't it? So through these foramens, below it is the infratemporal fossa. From the foramen, it's communicating to the middle cranial fossa through foramen ovale and foramen spinosum. Okay, so these are the communications. Now, what are the contents? The pterygoid muscles. There are two, lateral and medial pterygoid. Okay, then there is a nerve which is known as the mandibular nerve. This nerve with its branches. There is another nerve which is known as the chorda tympani. There is a ganglion which is known as the otic ganglion, and there are some connections. All of these are basically connected to each other mostly. Okay. Then there is an artery which is known as the maxillary artery. It's there with its branches, and there are this pterygoid venous plexus. So you can see over here. Okay. If you see this area, here is the infratemporal fossa. Okay. This is which bone? Anyone? This is which bone?
Zygomatic.
No, this one. This zygomatic तो काट दिया ऐसा था. हाँ, ये क्या bone है? So I already.
So palatine bone.
No. See, this is the infratemporal fossa, anteriorly guarded by the posterior aspect of the body of the maxilla. So क्या bone है ये? तुम्हारे cheeks का prominence क्या करता है? This is the cheek, isn't it? The prominence. This is the maxilla, isn't it? This is the maxilla. This is what? This is the. So this was the sphenoid bone. Okay, this is the part of the greater wing which is forming the roof of the infratemporal fossa, or you can say floor of the middle cranial fossa. Are you getting my point? This is the middle cranial fossa above. This is the infratemporal fossa below. So this is the greater wing of sphenoid. The body inferior aspect of the greater wing of sphenoid is forming the floor of the middle cranial fossa, floor of the middle cranial fossa, or the roof of the infratemporal fossa. So ये क्या है? Greater wing of sphenoid.
Sphenoid vein.
हाँ, इससे नीचे क्या आ रहा है? ये क्या प्लेट है? These are the pterygoid plates. Okay.
Pterygoid plates.
This is the pterygoid plate. So anteriorly it is maxilla. Okay. Medially it is pterygoid plates. Laterally it will be mandible. Posteriorly it is spinous process. So this area is the infratemporal fossa. So a nerve is entering inside over here. You see, there is a nerve which is entering in. From where it is entering, there is foramen ovale. Okay, and this is written cranial nerve 5. Okay, which one is the cranial nerve 5?
Trigeminal.
Trigeminal.
So trigeminal matlab 3, having 3 divisions. So you can see 1, 2, 3 divisions. Okay, and this is a ganglion. The ganglion of the trigeminal nerve which lies somewhere over here. The ganglion lies somewhere over here. So this is the ganglion of the trigeminal nerve. Now there are three branches which are coming from it. One is the first one is ophthalmic, then this is maxillary, and this is
Maxillary.
mandibular.
Mandibular.
Okay, ophthalmic, maxillary, mandibular. Now ophthalmic will again divide into three. It will enter in the orbit. Okay, the ophthalmic divide into three. It will enter into the lacrimal, nasociliary, and
Frontal.
frontal. So these three will open, move to the orbit through the superior orbital fissure. Okay, यहाँ से चला गया orbit में. There is another division, the second division, which is known as the maxillary. Okay, the maxillary will enter through another foramen. You see this, there is another foramen over here. This foramen is in the greater wing of sphenoid itself. See, this is the greater wing of sphenoid. So there are 1, 2, 3 foramens. Now this foramen is known as the foramen rotundum. Okay, this is the foramen rotundum. Okay, but the foramen rotundum is not opening into the infratemporal fossa. It is opening into the, you will get confused. It will get open into the pterygopalatine fossa. ठीक है, चलो ये हम देखेंगे बाद में. You can see this is the maxillary nerve through the foramen rotundum. Somewhere here is the pterygopalatine fossa, okay, to which infratemporal fossa is communicating. You're getting my point? This is the
one.
Huh? Contour?
Into picture.
No, yeah, this is the infratemporal fossa. Infratemporal fossa is communicating with the pterygopalatine fossa. Okay. Now, is this picture understood? This is the infratemporal fossa. This is the inside, deep, there is the pterygopalatine fossa. Is this picture understood?
Yes, sir.
Yes, sir.
Okay, so if you see somewhere here is the foramen ovale, the mandibular nerve will come. Now the maxillary nerve is going forward. Okay, maxillary nerve is going forward. Where forward? Near the pterygopalatine fossa. Okay, so one of the content of the infratemporal fossa is the mandibular nerve, which is moving in from the foramen ovale. What was the other? The maxillary artery. Okay, the maxillary artery branch from the external carotid. You see, this one is the maxillary artery occupying the infratemporal fossa. Okay, then what was it? The pterygoid venous plexus. So the whole this area, pterygoid venous plexus, the maxillary artery, and the mandibular nerve. Okay, passing from the foramen ovale. So these are the main contents of the, कहा गया contents लिखा था मैंने. Okay, contents of the apart from the pterygoid muscles. Okay, these are the contents of the infratemporal fossa. Plus there is another nerve which is known as the chorda tympani. We will discuss about it. There is another nerve named as chorda tympani, and there is a ganglion which is known as otic ganglion. Okay, till here is it understood?
Yes, sir.
Yes, sir.
Chalo, now let's see the muscles. Okay, see, the first thing is that you should have an idea about what is going on. I mean, if you can't imagine the fossa and the contents and how the things are related, it's no use just mugging up things. Okay, so if there is any doubt, I can repeat it. So please respond to it. Okay, so is there any doubt, or shall I need to repeat anything?
No, sir.
Okay, so the pterygoids. So these are the muscles which are occupying, which occupies the infratemporal fossa. There are lateral pterygoid, there is medial pterygoid. So this over here you can see the lateral pterygoid muscle. Okay. So the origin of the lateral pterygoid comes from the infratemporal surface. Okay. It originates from the infratemporal surface. Okay, just see. This is the Infratemporal surface. Okay, so from here one takes the origin. Okay, there is a crest over here, not shown very well in this picture. So that is known as the infratemporal crest, somewhere here. Infratemporal crest in the inferior aspect of the greater wing of sphenoid. I can show you. This area, sorry, over here, there is a crest, infratemporal crest. Okay, here. So from there, there is the upper head. The lower head comes from the lateral surface of the lateral pterygoid plate. So you have seen this is the lateral pterygoid plate. So the lower head comes from here, upper head comes from somewhere there. Now these two heads will combine and they will get inserted in front of the neck of the mandible over here. Okay, in front of the neck of the mandible. They will get inserted here. Okay, now its nerve supply is the anterior division of the mandibular nerve. The mandibular nerve, which appears in the infratemporal fossa itself, will supply the muscle.
Patricia.
So, and the action is it opens the mouth, that is, it will open or depress the mandible, protrusion of the mandible with the help of medial pterygoid, and side to side movement with the help of the medial pterygoid. Okay, so this is the lateral pterygoid, two areas, upper head, lower head of origin, and insertion in front of the neck of the mandible. Okay, nerve supply, mandibular nerve, anterior division, main action, opening of mouth. Again, there is another, this one is the medial pterygoid. Okay, so it has got a deep head. The deep head will be coming up from the medial surface of the lateral pterygoid plate. Okay, so lateral pterygoid plate is this one. From this surface is the lateral pterygoid muscle coming up. From inside, I mean the medial side of the lateral pterygoid plate. Okay, from this plate only, but from the medial side. That means this is the lateral pterygoid plate. From this side, from the lateral side, the lateral pterygoid muscle. From this side, the medial pterygoid muscle. Okay, so the deep head is coming from the medial side of the lateral pterygoid plate. There is a superficial head which is coming from the tuberosity and the head of the maxilla. I'll see whether I can show you. Can you see this protrusion over here? This protrusion over here.
Yes.
This protrusion. This is the tuberosity of the maxilla. Okay. So the other head is coming from the tuberosity of the maxilla. Pyramidal process of the palatine we will discuss later on. Okay. And they get inserted into the medial surface of the ramus and the angle of the mandible. Okay. They get inserted over somewhere here. This is the angle of the mandible and the medial surface of the ramus. Okay, they get somewhere inserted here. Okay, what is the action? The action is elevation of mandible. Here, the action is opening of mouth or depression of mandible. Here, the action is elevation of mandible.
No, PG.
Okay, and the nerve supply is the mandibular nerve. So in case of lateral pterygoid, it was anterior division. Over here, this is supplied by the mandibular nerve, but by the trunk itself. Okay, so these two muscles are there, which will be occupying the infratemporal fossa. Okay, medial and lateral pterygoid. Is it okay till here?
Yes, sir.
Sir.
Yes, sir.
1240.
Okay, so let us just discuss
1245.
the mandibular nerve. Okay, so we have seen this is the trigeminal nerve, the three divisions coming up from the trigeminal nerve. The first one is moving inside the orbit through where? From where?
Orbital fissures, sir.
Supraorbital fissure. The trigeminal nerve, the maxillary nerve will enter the pterygopalatine fossa through where? What is this foramen?
Rotundum.
Rotundum.
Foramen rotundum.
Yeah. Now the mandibular nerve will enter the infratemporal fossa through which foramen? Foramen
Ovale.
ovale. Okay, so let us discuss the mandibular nerve. So this is the largest division. So over here, this is the mandibular nerve. This is the foramen ovale. This is the largest division. In this picture, you can see. I'll try to. Can you see? Okay, wait. Lag. So it's very difficult. Can you say this? It's becoming blurry. Okay, leave it. So again, I'll show you. Foramen ovale, spinosum, rotundum, superior orbital fissure. So the trigeminal nerve will lie like here, ophthalmic division, maxillary division, mandibular division. Okay. So this is the largest, the mandibular division. It's a mixed nerve, both sensory and motor nerve. Okay, there are two routes. One is sensory route, one is motor route. Just remember that. And the motor route, just when it comes out from the foramen ovale, both of them joins to form a single nerve. Okay, and medial to, am I having a picture for this? Okay, and medial to this nerve, there is a ganglion attached, which is known as the otic ganglion. Okay, so this is the largest division of the trigeminal nerve. It is a mixed nerve. It passes down from the foramen ovale. It has got two roots, sensory and motor, and there is a ganglion attached to it. It is the otic ganglion. Now, this otic ganglion is responsible for parasympathetic supply to the parotid gland. Okay? Stop confused. You are there? Ganglion
but they
so
know
this,
that parasympathetic.
this parasympathetic part, the parasympathetic, there are four ganglions. Okay? The parasympathetic ganglion. See, parasympathetic is what type of flow? This is craniosacral outflow.
Craniosacral flow.
Craniosacral outflow. Okay, what is the function? For vegetative function, whenever we sleep, whenever we take rest, not for emergency, all the vegetative functions, parasympathetic. Matlab, we have to eat, we have to digest, isn't it? That is the parasympathetic action. So when we eat, there is the secretion of the saliva from the parotid, from the other glands, submandibular, all these glands. Okay. So this action is mediated by the parasympathetic system. Here, the craniosacral. So the cranial part is controlled by four ganglions. First one, the otic ganglion. Second one, the first one, ciliary ganglion. Second, otic ganglion. Third, pterygopalatine ganglion. Fourth, submandibular ganglion. Okay, four ganglions. Again, I'll repeat: ciliary, otic, pterygopalatine, submandibular. Four ganglions are there. Now, these will be controlling the parasympathetic from the secretion, the cranial part. Okay. Understood? Have you heard the names of this ganglion earlier?
Yes, sir.
Yes, sir.
See, all these ganglions, the otic is functionally related to the third cranial nerve. What is the third cranial nerve?
Oculomotor.
Oculomotor.
So the otic is functionally related to the oculomotor nerve. Okay. The ciliary is functionally related to the oculomotor nerve. Otic is functionally related to the glossopharyngeal nerve. Okay. Submandibular is functionally related to the facial nerve. Okay. Pterygopalatine again related to the facial nerve. Okay. So this is, and all these, the ganglions are mostly topographically, that means structurally they are hanging by the divisions, any one of the divisions of the trigeminal nerve. You understood? They are hanging or they are structurally just attached to one of the divisions of the trigeminal nerve, but functionally they are related to 3, 7, 9. Okay. Third is oculomotor, seventh is facial, 9 is glossopharyngeal. Okay. But structurally, see this structurally, now this mandibular nerve we are discussing here, the mandibular nerve. The otic ganglion is attached to it, but only structurally. Okay. Like the ophthalmic division. To the ophthalmic, okay, the ciliary ganglion is attached, but only structural. Okay. Similarly to the, you have seen in this picture, this is the pterygopalatine. Okay. It is structurally attached to the, what is this nerve? What is this nerve? Maxillary nerve. So one of the division of the trigeminal nerve. So somewhere here the ciliary ganglion to the ophthalmic. Somewhere here the pterygopalatine to the maxillary. Somewhere here the otic to the mandibular. Again down if you come, there is another ganglion, the submandibular. It is attached again to the branch of the mandibular. Okay, the lingual nerve. So these are the 4 ganglions. Okay. So here we will encounter 2 ganglions. One is otic ganglion and another is submandibular ganglion. And these are structural relation of the mandibular nerve. Otherwise, either facial or glossopharyngeal. Okay. You see, the mandibular nerve, there is a trunk. Okay. Okay. Then there are branches, anterior branch, posterior branch. And this is the small anterior branch. This is the trunk. This is the anterior branch. This whole is the posterior branch. Okay. From the trunk, there is a nerve which is known as the nervus spinosus or meningeal branch of mandibular nerve. I think they have not shown here. Now that nerve, the meningeal division of the mandibular nerve will pass through foramen spinosum. Okay. And it will give the supply to the dura mater of the medial cranial fossa. Okay, so where does it come from? It comes from the trunk of the trigeminal nerve. Okay, then there is another nerve to the medial pterygoid. Okay, nerve to the medial pterygoid. Now these two are coming from the trunk. Okay, as we have discussed for the medial pterygoid already. Now from the anterior branch, this one, what are the nerves? Mesenteric branch. You can see this branch. This is the mesenteric branch lying above the lateral pterygoid. It will supply the masseter muscle. Deep temporal nerve. Okay, now deep temporal branch is going up above the zygomatic arch. Okay, and this will be supplying the temporalis muscle. There is nerve to the lateral pterygoid. This one supplying the lateral pterygoid, and there is a sensory nerve which is going like that, and this is known as, this is the buccal nerve. Okay, which is sensory to the mucous membrane around the buccinator muscle. So the mandibular nerve is a mixed nerve. So from the anterior division, these are the branches. So one sensory, rest motor. Okay. Next, from the posterior division, you can see there is a nerve which is going like that, encircling an artery. This is an artery. Okay. This is an artery. This is the middle meningeal artery. Okay. This is the middle meningeal artery, and the auriculotemporal nerve is all around it. Okay. Dividing into two and again fusing up. Going up. Okay. As combining, two branches will combine to form the auricular nerve. Okay. Now this artery, the middle meningeal artery, also passes from the foramen spinosum. So what are the two other thing which was passing from the foramen spinosum? Narrow spinosus coming from the trunk, isn't it? The other is middle meningeal artery. So it will come up like that. So middle meningeal artery, this one, coming in from the foramen spinosum. There is the auriculotemporal nerve, which is formed around it by moving around it. So it is sensory. So it is having an auricular branch, a superficial temporal branch, and some articular branches to the temporomandibular joint. Okay, so 3 branches. All these 3 are sensory. The auricular branch will supply the auricle, even the tympanic membrane. Okay, in the external acoustic meatus, the outer one, the outer part, the floor and the posterior part. Okay, so this is a sensory branch. Okay, then the inferior alveolar nerve. The inferior alveolar nerve, this is a mixed nerve. The inferior alveolar nerve is a mixed nerve. This will, see, this is the inferior alveolar nerve. This will run in a foramen which is lying inside the mandible, and this is known as the mandibular foramen. See this, they have cut the mandible, and this is the nerve, inferior alveolar nerve. From the trunk, it will supply the alveolar sockets and the gums, okay, of the premolar and molar from the trunk. Rest it will divide into incisive branch and mental branch. The incisive branch will give division to the incisor and canine. Okay, incisor and these are sensory branches. Okay, incisor and canine sockets and the gums around it. And lastly, the mental nerve will come out from the foramen, which is known as the mental foramen. Okay, which is known as the mental foramen, and it will supply the skin over here in the lower lip and this part of the chin. Okay, so this is the inferior alveolar nerve. There is a nerve which is coming again from the inferior alveolar nerve. This is known as the nerve to mylohyoid. Okay, this is the muscle which is known as the mylohyoid, which lies in a triangle near the neck. Triangle hole, no? In the carotid triangle, even in the digastric triangle. Okay, so there is another which is coming from the trunk of the inferior alveolar nerve. This is known as the nerve to mylohyoid. Okay, so it will supply the anterior belly of digastric and the mylohyoid. Next is the lingual nerve. So we saw branches from trunk, we saw branches from anterior division. Okay, and then the posterior part, auriculotemporal, inferior alveolar. Okay, inferior alveolar, and the last one is the lingual. Can you see this? This one is the lingual nerve. Okay, this one is the lingual nerve. Now, one thing I forgot, for the auriculotemporal nerve, the postganglionic secretor motor for the parotid gland through the otic ganglion travels through this nerve. Okay, so when we discuss the ganglions, we'll discuss it in details. Similarly, the lingual nerve, you see this is the lingual nerve. Okay, this is the lingual nerve. So it lies anterior to the inferior alveolar nerve. Okay, lays over the medial pterygoid muscle. Okay, and then the buccinator. Okay, and near the premolar, it lies just below the mucous membrane. Now this lingual nerve is joined by another nerve, which is a branch from the facial nerve, a small branch. Can you see over here? This is the chorda tympani. This lingual nerve is responsible for the general sensation of the anterior 2/3 of the tongue. Okay, and the floor of the mouth. The chorda tympani which joins it, okay, through the lingual nerve, the chorda tympani is responsible for the taste sensation. of the anterior two-third through the chorda tympani. So chorda tympani, taste sensation, lingual, general sensation. And both are communicating with, the chorda tympani is communicating with the lingual nerve. Okay, and again the preganglionic fibers for these glands, like the otic one was for the parotid gland, the sublingual ganglion is for the sublingual and the submandibular and the sublingual gland, the submandibular ganglion. So these preganglionic fibers, they are coming from the chorda tympani for this submandibular ganglion. So lingual nerve, shall I need to repeat or it's okay? I think I will just stop here today. Is it okay?
Yes, sir.
Yes, sir.
Okay, or shall I need to repeat any of these? What?
It's okay.
It's okay. So you just go through at your, so any problem with these nerves and its branches, and plus you go through this to this otic and the submandibular ganglion. We will discuss it a little more in the next class. Okay.
Yes, sir.
Chalo. Thank you. Thank you.
Thank you, sir.